I really like the way we can apply what we learn in class and, see a real life situation of it. They can tell us as much as they want during lecture about an internal bleed and how the patient is going to be cyanotic and his blood pressure is going to drop. But until we're dropped in that situation and we can see it firsthand, there's no comparison at all. And I just think it's really wonderful that, Northland has the simulation truck, because I think it will make us better nurses.
Northland Community and Technical College in East Grand Forks, Minnesota has assembled this mobile patient simulation lab, which utilizes a SimMan 3G mannequin, the most realistic a mannequin can get. Students get the opportunity to use the trailer and everything in it, from working oxygen to programmable heart monitors, so Pat, the name given to the mannequin, can react to certain situations.
He is a patient simulator class of mannequin. He does a lot of things. As you can see, he blinks, he breathes, his chest moves in and out with breathing. His pupils will react if we shine a light in them. He sweats, he cries, and anything he does, any sounds he does, anything responses he does, we can completely control. I can change how his pupils react, I can change how he blinks, how he breathes, what the lung sounds are, any of that.
The students that get the opportunity to work with Pat and the simulation lab include LPN, RN, respiratory therapy, paramedic, and cardiovascular technology students. There are also multiple scenarios that can be done so that the students will get to experience different situations that can occur.
We can set him up to do scenarios in the trailer here, of course, but he's wireless, so we can go outside the trailer and to go into a patient care room, into an ER room, into x-ray or physical therapy, out in the grass, on the berm, in a car, in an apartment, wherever we want to run a scenario at. This summer we went to one hospital and we did a motorcycle accident where we had Pat here was driving his motorcycle and lost control and hit a power pole, and in the process his leg went across a guide wire and amputated his left leg. So we had most of his left leg laying by the motorcycle, and then Pat was over in the grass with an amputated stump here that was having a major bleed and stuff, and so the EMS personnel had to go and take care of him and get him packaged up and control the bleeding and get him to the hospital.
It's an asset for the college because it allows us to have like a real situation and to feel the real pressure, and also to be able to have the critical patients like this, because obviously in clinical we'll have our instructor or a co-signer with us, and this gives us an opportunity before we go out into the real world, just so we're not so nervous. It's not as much pressure, and it allows us to learn a lot of the heart sounds and the lung sounds, where normally it's just a recording that we hear. We don't get to hear it through a stethoscope. So I think it's an awesome asset for the college.
The lab is also used to go visit various hospitals and other healthcare organizations throughout northern Minnesota to work with staff on critical care patients.
We go out to the rural hospitals and work with the hospital staffs to do skills training or scenarios, depending. We've gone up and helped with some skills trainings in one hospital up in northern Minnesota for 3 days, and other hospitals just doing general scenarios for critical patients, just to work with some assessments and treatments for those patients.
Along with Pat, Northland plans to extend the family of the lab with the addition of a Sim Junior, a pediatric size of Pat.
One other mannequin is a Sim Junior. It doesn't do quite as much as Pat does, but almost. So we'll have him that we'll start to be able to do some pediatric scenarios with. And we also have a grant submitted right now that part of that grant would be to get a Sim Baby, an infant-size mannequin that does all kinds of interactive physiological things just like Pat does here.
For Northland Today, I'm Jacob Anderson.